Did you know that the mathematicians have told us that there's 128 million combinations of how the human spine could misalign? Now that's a crazy number. How'd they come up with that? Well, the spine has many different directions that it can normally move. Just for instance, we can move this way, we can move this way, we can rotate this way, we can rotate this way, we can flex, we can extend, and that's just in the neck. We can side bend, but we can do also these movements in the mid-back, and we can do these movements in the low back as well. And when you put all those combinations together, we end up with this astronomical number of 128 million possible ways the spine can move. Since the spine could move that way, if we have a trauma in these complex directions, an injury, a fall, a slip, a car wreck, any of these different traumas, we can create a pattern of that direction of misalignment. Wow. So from the practitioner standpoint, from the chiropractor standpoint, what we have to do is to figure out exactly what each patient's individual pattern is. And how do we do that? We do what's called a discovery exam. The discovery exam checks the patient's posture. We check through just visualization. We're just looking at the patient. We may take a computerized photograph called a posture screen. We may take a specific set of x-rays, and typically we do all three of them. That's the most typical discovery exam. Check each nerve, but in terms of the posture part of the exam, we're looking at what that patient's individual postural misalignment is. Once we figure out what the pattern is, then we can come up with strategies to go opposite of the pattern to bring them back into normal alignment so their body can heal. The key to this is to have the examination give us the information to know exactly how a patient's posture is misaligned. Patients commonly come in and they say, Doc, I've got bad posture. Okay, but what does that specifically mean? We've got to find out what that bad posture is so we can come up with a strategy with using our techniques to correct that bad posture so we can end up with good posture so that we can take the stress off the nervous system and the body can heal. 128 million combos? Well, we better be very specific in how we analyze that during the discovery exam. But once we figure out what it is, then we can come up with strategies of correction. Figure out what your pattern is, that'll give you your chance of actually getting this correct.